uh, able to join. So this is the November meeting of the Global Climate Change Committee. Thank you for joining. Our speaker today is Dr. Latressa Gordon, our new co-chair, and we're excited to be hearing from our very own co-chair today. Dr. Latressa Gordon is a U.S. Army veteran and a nurse with more than 35 years of experience in clinical care, community health, and public health leadership. She serves as the Director of Public Health Nursing and Navigator Programs at Michigan United, where she leads statewide initiatives focused on cancer support, chronic disease prevention, climate, environmental health, and health equity advocacy. She is recognized for her work in cancer navigation, including contributions to the Biden Cancer Moonshot, the Flint Cancer Feasibility Study, and transportation support for cancer patients. Dr. Gordon also serves as the co-global chair for climate health with the Alliance of Nurses for Healthy Environments, a Voices of Black Women ambassador, and a legislative ambassador with the American Cancer Society Cancer Action Network. Her work centers on strengthening community partnerships, expanding access to care, and uplifting marginalized populations through culturally responsive, evidence-based public health strategies. We welcome Dr. Gordon, and I'm going to turn it over to you and start the slides.
Yes. Good evening, everyone. It's a pleasure to be among each and every one of you. So we'll just go ahead with the slides. See here. So how's everyone else doing? Okay. All right. So everyone on here is no stranger to like planetary health and climate community engagement. So my take is like, from my perspective, is basically how I incorporate the work that I do, being a trusted voice in my community, and how trajecting it across different states and globally. So planetary health and climate community engagement, advancing environmental justice through nursing leadership. Next slide, please. Okay, so this is just about our Earth. We all know about the Earth that we live on. Earth supports life. It's the only planet we've known with the conditions that we can, so far. I mean, NASA says other things, but we're working on Earth today. Diverse environments. Earth environment range from vast oceans, dense forests, arid deserts, and icy polar region. And with protective atmosphere, Earth's atmosphere shields us life from harmful radiation, stabilized climates, making life possible. Next slide. Okay. What is planetary health? Everybody on here pretty much knows this. So the health of human civilization and natural system depends on it. Recognize that human and environmental health are interconnected. Emphasis on sustainability, biodiversity, and preservation of natural resources. Next slide. Okay. Okay. Climate change as a public health emergency. Extreme weather we know increases injuries, displacement. Air pollution causes of respiratory and cancer diseases, cardiovascular diseases. Rising temperature, intense heat also messes with like allergies and other health conditions. And then food insecurities, food, water leads to malnutrition and disease. Environmental stress contributes to mental health challenges. So we know that all this ties into the social drivers of health. Okay, next slide, please. Okay, the roles of nurses in planetary health. We serve as trusted messengers in the climate communication, integrate environmental screenings into health assessments, advocate for sustainable healthcare system, educate patients on climate-related risk and mitigation. So integrating that into becoming a trusted voice is getting out into where your community or other communities having cultural competency, cultural humility, and just starting that conversation, finding out where your community or other communities having town halls, finding out, bringing the community members in as people that have a voice about what's going to go on their community. So instead of going into a community like, oh, I'm going to teach you today on planetary health, like, what do you know? What do you want to know? So having that involvement of the communities that you serve or communities that you go into, even if you don't look like the people in that community, just having them as also having their voice. Next slide, please. Okay, so everybody already know about this. The Alliance of Nurses for Healthy Environments was founded 2008, engages nurses in environmental health actions focused on climate, toxins, energy, food, and water, provides toolkits, webinars, advocacy training, and mobilized 1,000 nurses for environmental justice and initiative. So that's Alliance, which everyone out here pretty much knows about. I'm kind of new. I just kind of joined in like within a couple of years. So I'm excited because I really didn't know one of kind of, organization like this exists. And another thing is how can we pull more nurses or healthcare providers into doing this work? So a lot of people think like it was another thing on my plate. How do I get started? They really don't know how to get started. But once you teach people how to get started, invite them in, it's kind of like a wildfire they'll take to it, connecting their passion to the resources and how they can get involved. Next slide, please. Okay. So again, about that community engagement and action. So some things that I do in my community that are engaged in DC is, food is medicine program linking the nutrition to chronic disease prevention. That's a service that we have. We do a webinar. We go out into the community, teach people about sustainable gardening, like box gardening. Also providing like testing the soil, teaching them about and my daughter, I had to bring her in. She's the only mushroom expert in Genesee County where we are. So we take people on foraging, teaching them actually how to find like sustainable food. So mushrooms for some people are sustainable food, and then also the growing, the box gardens and those things, and having climate education on how people can use food as medicine. And tying in also another thing, I tie in hypertension and climate health clinics, integrating that environmental education. So in every work, every chance that I to come in contact with a community member, anyone, we tie in, intersect the environment. So, right here, I'm in Flint, Michigan. So I grew up in Flint, Michigan. So if you don't know, we have the water crisis was one of the big things. And then we had also during COVID, and then also because General Motors is an industrial town there, we just had, I also advocate with Michigan United. We do a lot of advocacy work, going before legislation. We had an Ajax plant. And where was it planted? Of course, in a marginalized community that was already suffering from high incidence of pollution, asthma, and other chronic conditions. So I also go into like the schools, and we teach about um, how like asthma and different type of environment, children, different things about the planet. Like we have a green day. So we would have paper bags, and color the paper bags, the earth, and different those little things, and hand out information about climate. And, when I was a kid, it's kind of went back when I was like in kind of off topic, but I was like probably like first grade, and it was called, I don't know, Hootie the Owl. And it was called Don't Pollute, And so I remember I was on that commercial, telling people not to pollute at 5 years old. So it kind of full circle moment coming back and to be able to talk about the importance of climate health and also teaching people how to be more healthy. So the cancer feasibility study, this is a 5-year study through the CDC and also Michigan State University. Other partnerships in the community are coming together for this study, and we are providing, town halls. We had 2 town halls, getting again the input from the community and tying in the water crisis. Is it possible that there has been an increase of cancer? We don't do the cluster studies anymore, increase of cancer due to the pollution from the water. We also they have the lead, but now they've got the different like the PFAS, all the other chemicals. So there's been an increase in like blood cancers in Flint, Michigan. I think it was like a whole block of neighbors, and every neighbor from a house of like between 20 houses all developed some type of aggressive blood cancer. So we're doing this feasibility study, tying in the environment and teaching the community about how you water. And then I don't have that one on there, but we passed out do the for air quality. We had an air quality monitor, and someone destroyed it. So we worked at getting another air quality monitor so people can know, like, we're close to Canada. So we had the Canada wildfires were actually increasing, like, respiratory issues. Also look at low birth weights with mothers. So we passed out like masks, also just not teaching people being proactive. Like we do the blood pressure, we give them a blood pressure machine. So if they're having issues with respiratory, we provide them with masks and also filters for their homes. And also there's another study coming along down the pike that I'll be involved in with the looking at the low birth weights and with pregnant mothers with the air quality. And then also addressing like gun violence and environmental stressor, health equity. So we know that when the temperatures rise in different climates, they can also be indicator of increasing violence in our community. So we tie that in, or I tie that in as well with my studies that I do. Next slide, please. Okay, so climate injustice and health inequity. Okay, environmental hazard disproportionately affects marginalized communities, just not the marginalized communities, but all over. Community of colors and often face higher pollution exposure. Climate adaptation strategies make center equity and justice align with healthy people. So basically, we fight for those that have no voices, going in the disenfranchised community or any community that will, hey, something's going on in my community, the water, the air, they're building this plant. So that's what my role at Michigan United is in public health. And we have navigators that would go door to door and find out, have your pipes been replaced? Is there any type of issues that want us to address and take back? And then we'll go into, do Capital Day, go into talk with our, as constituents talk about these things. So also my biggest thing I just got on the bill is affordable water now, having clean, affordable water, and preventing shutoff. So that's on right now. We have like 4 bills on that in Representative Diemendorf and Representative McNeely. Been working with those. So clean water, affordable water, that's a really big issue because, water is life. And in this community and communities across our country and globally, that's a big issue, is having clean water. So some of the things that I advocate for. Next slide, please. I think this might be, okay, strategies for effective community engagement. Okay, organize the climate health and town halls, collaborate with your faith-based organizations and schools, train nurse navigators as climate educators, a climate ambassador as well. So use storytelling, art, media for awareness, engage youth. So that's the biggest thing too, is pulling in the youth now. So they're one of our biggest champions, is using them, giving them a voice and getting them as, climate ambassadors. So youth and sustainability initiatives are some of the things that you can do for community engagement, which you probably already might be doing in your community, but those are some of the things that we do, like say that partnership with the community, having the community as a partner and partnering with other organizations, trying to break out the silos and, get people, somebody might have this program growing instead of duplicating it in the sustainability of programs. Okay, next slide, please. Okay, global collaboration learning, cross-border knowledge exchange encourages nurses to share best practices between nurses worldwide to address the intersection of climate, environment, and health equity. Educational impact builds nursing capacity to respond to climate-related health crises, integrating global health frameworks, UN Sustainable Development into practice, sharing best practice, and strengthen global nursing advocacy. So some of the things you think, oh, we're only doing this here in my city, or we're only doing this here in my state. So here, looking at the big picture of the whole global, find out what others are doing and how we can learn from each other and integrate those practices. That's also a good strategy, because it's more than one way, as my grandmother would say, to skin a cat, or there might be. Okay. And next slide. I think this might be wrapping it up here. Okay. The power of collaboration. So that is the biggest thing. Like you say, we always say it takes a village to raise a child. That's the African proverb. But I always say it takes, a community or an organization. It takes all of us to hold hands. Like, in the military, we always say, I have to hold the line. So someone is always the anchor holding the line. So when I'm holding the line and somebody's tugging on me, the more people that join in on me while I'm holding this line, we're able to hold our position. So we're able to hold our position on innovative through diversity. Collaborating brings various skills, perspectives, stimulating creative thinking and innovative solution, enhance problem solving, team collaboration, share unique leads, leading to effective creative problem solving, and building trust. That's the biggest thing in any organization, even when you're partnering with other organizations, is building that trust. Being a trusted voice, being a trusted organization brings trusted resources. So collaborating strengthens that communication, builds trust against team members, and increase overall productivity. Okay, and next slide. Okay, call to action. Nurse leaders, health leaders, integrate climate health into nursing education. Dr. Kent Boyd, I think he's already doing that. advocate for clean air, safe water, sustainable systems, join any and other coalitions, and empower our community to be climate resilient. Next slide. I think that is it. Okay, that's just a few references. Okay. Okay, thank you. And that wraps up my presentation on the work that I do and also how to integrate it into nursing practice and perspective. So now we can have some dialogue and discussion.
Thank you so much, Dr. Gordon. That was wonderful. You do so many amazing things. So I hopefully we can have a good discussion.
Oh, yes.
Does anyone have any thoughts about how we can, incorporate the planetary health goals that Dr. Gordon mentioned into this committee? Peggy, yep, you're on mute. Oh, oh,
Peggy was applauding that,
oh,
yeah.
you were applauding. Okay, I thought you raised your
Oh,
hand.
okay. So I know that we have to come up, we're working on in this our committee. So I know everyone has wonderful ideas. So getting that brainstorming together, coming up with our strategies and focuses, on like we got to get the Jedi, as Millie says, working on those different things. So I'm interested in your community. How are you engaging or advocating on the level? Are you going to, legislation? Are you local? I'll do all three, like in local, our local, city hall. We're involved in that. We go to our capital here in Lansing, then also in DC for Advocacy Work Michigan United. So, and I can put that also into the chat if anyone will learn for the advocacy piece too.
That'd be great. Yeah, if you could put that in the chat. And I see Jessica, our Jedi co-chair, has joined. So I'm so glad you're here, Jessica. um, yeah, so did anyone have any other thoughts or questions for Dr. Gordon? I know everyone on this call does a million other things. So I know you guys are all being quiet, but you all.
I also developed, like, say, to help the team is like start out with myself, and then I was able to get some grant funding and get 14 other registered nurses with like over 200 years of different experience, and then like 14 nurse navigators that actually started out for COVID. And then when I went out with COVID, all these other social drivers or social determinants of health present, like, before you can talk about, education on the vaccination or this, that, and other, hey, my water filter is still turning red, and is it safe to use as water filter? Or, I don't have any water, the bottle, they stopped providing, because, we had all these drives where we were providing bottled water. That was up until last year. So now, people had to start paying for their water. Then the SNAP benefits started, getting cut back. So it kind of all goes into that big melting pot together. So it was out there, well, hey, I got education trying to decrease vaccine hesitancy with the CDC. And then like, well, that's all fine and good, but I don't have clean water. Or we have asthma, and, and the air is quality. So that's what kind of got me like, okay, all these issues. We already had the water crisis and the lead. And so it's like just interesting getting out and with the community. So we have, I think Peggy was first, was it?
I actually think
Or I'll let you.
Christina. Yeah, I think
Stephen. Okay. Oh, you're on mute.
You're muted, Christina.
Sorry. I had to change rooms real fast. So the first thing you said was I think there's a lot of people that want to be involved but don't know what to do. And I'm kind of in that camp. And I think that we have a lot of skills that we probably can compile to actually make headway. And one of those skills, I'm a master gardener through MSU Extension. So I don't know if you've ever tried to partner with the Master Gardener program for your gardening projects. But that would be somewhere where, at least in our area in Michigan, we could maybe connect. I'm also part of Michigan Public Health Association, and we're kind of like trying to figure out how to get people kind of on the same page and get things moving in the right direction in multiple areas. I'm more in the policy and advocacy group there. So I think maybe breaking out into like certain subgroups would be helpful in this respect. And then seeing, what particular skill sets each of us have and how we can impact all of our communities, because I'm sure other people have different skill sets, not just nursing.
Yes.
So that's all.
So I'm on the Food Policy Council, and we partner with MSU Extension for the gardening. So we just actually had a Food Public Council. Our first one was a couple months ago at the Flint Farmers Market. And so I
Okay.
did a presentation on food as medicine. So I work heavily with Michigan State University. That's what we do with the studies and all the other things as
Awesome.
well. So we can definitely connect with that, because we do have like a lot of gardens out there, like teaching the box gardens. You can come, vice versa, and I can send you that information, the link, and then some stuff for Michigan United States, because we go all over in Michigan, and everybody's skill set. Yes, that'd be great.
There we go.
Ebony? Ebony, did you have a
Yeah.
question? Okay.
Yeah, sorry. I'm like, let me find the unmute button. Um, so I'm really new to the kind of this whole environmental justice space, and but have been learning so much. In my role, I am definitely in the policy and advocacy space, but I guess my broad question is, in my community, trying to mobilize nurses to do anything is a challenge. And
Mhm.
I do find that like cross sector and multi-sector collaboration is what gets her done, because and then you're involving everybody, you have a shared mission. But how do you get, nurses, particularly at the bedside, to really see their role as kind of stewards of environmental justice? And how do we kind of change that perception of it? I think sometimes people feel like they're not the expert at something, so they don't feel like they can be involved in some way. I know some of the projects that we've looked at here, kind of pairing food insecurity with a community garden project, and we've talked about doing so many different things that are more smaller scale and not anything too grand, just because of the infrastructure we have, so to speak. So just wanting to maybe get some advice about that as I'm in my role that I have.
Okay. So, it's like advertising, kind of putting it out there. It's like, your tribe will find you, as I always say. So those that are interested, I don't know if you can do like maybe little town halls that, like your library hold it, or webinars, and like, this is what I'm planning on doing this. We need volunteers, or different other nursing organizations, or even if you work within your organization, we're going to start up, a group, like a advocacy group or council group. There'll be, some good ways, because how the nurses that I, like say, fell into again was like I started out by myself with um as COVID, and then because when I went out there I had such a big demand need for it, I was able to get grant funding, and so I was able to pay some of the nurses to get out there. So small stipends that always bring people out, but once they, the stipends went away, the money went away from that project, the nurses stayed because they found a new passion. And we always call it, from the bedside to the curbside to, to the, to legislation. So and boots on the ground, that grassroots. So just kind of, putting a filler out there, maybe putting a sign up sheet like, we're going to do this project. We need nurses, and you might find retired nurses that might come in, or some of the also partnering with some of the local nursing colleges and getting some of the nursing students to grab them. So I work like with my community college, the other colleges. So we'll get the students to come out with us in the community as well, and teach them how, the climate advocacy. So those are some of the maybe little things that could happen. But I know most people, especially nurses, we're already not just us, but we're already overworked, with overwhelmed. And you got, right now the patient load is huge. You got, at the hospital here, Henry Ford, we're fighting right now. The nurses are having 11 patients to one nurse, and one more thing I can't handle talking about, climate. But if you don't, back in the day, like I said, I've been in this game for a long time. So, you just kind of have a little time to talk with your patients at the bedside and find out a little bit about them before you have to, scare away or look on your computer. And they might tell you, like, hey, I have this old air conditioning in my house, and, I have mold in my basement, and then you can kind of like, oh, you do, well, let me, connect you with this resource. So most of my work is just connecting with resources. I see Peggy is next.
Hey, thank you. Dr. Gordon, excellent. Thank you so much. And I definitely love bedside to curbside. That would be a real bringer inner, so to speak. Uh, for me, it's like, as I said to Ebony, they have their kids, And maybe one of the ways is to pull their kids into the same group uh,
Yeah.
intervention, especially Master Gardener.
Oh, yeah. Yeah.
Get them involved. I
Uh-huh.
have neighbor kids that jump my fence with their parents,
Oh,
and
nice.
they work their garden in my backyard because I have,
Hmm.
I have areas for that. But the other side is find your niche. What
Yeah.
do you really like to do? And I'm currently with Popco and Break Free from Plastics. Popco is People Over Petrochemicals. It's a regional group. So I work with them, and I work with Break Free from Plastic, which is a international group. And we're working on the US narrative. So I guess I'm working on how to promote their policy. I mean, it's what you like to do. If it's wordsmithing, great.
Hmm.
If it's getting your hands dirty with master gardening, that's
Yes.
great too. And I just love your bedside to curbside. I may like adopt that at some point in
Mhm.
time.
Yes. Hmm.
Thank you. Thank you. Thank you very much.
Thank you for your input. All those are excellent ideas. So like so we all have like, like Christine said, more than skill set besides nursing, like you said, the master gardener or even like, whatever you have, bringing that to the table. Like, in the military, I refer back to that. It's like, you have your rucksack and you got more than one tool in there. So, you're already set up for battle. So whatever you have, taking that and, bringing that to the forefront, like say, finding your niche. What is your passion? Like for me, water because where I live and also because of my family with the asthma. So that storytelling is huge. Like I say, when we go before legislation or other people and we can break out our American Lung Society, these are the stats, or in Brazil or Mexico this is going on, but those personal stories, like this is how it's impacted me, that's what pulls on the heartstrings or draws attention, gets their attention and make them look up like, hey, listen to me. um and my whole family was poisoned by the water crisis. I have grandchildren, or I have I have asthma. And then, Dr. Ken, he brought up, like, I'm like, I was at a thing about, and they had a big inhaler. And then also now talking about how the carbon print from the inhaler. So now every time had to puff my inhaler, like, oh, no, I'm adding, getting another carbon footprint. So just those different things and educating, like say, starting small and growing out. And then people, like, if they have the opportunity, starting those like sign up sheets, maybe doing, different type of presentations like this in, the library or different communities. And that'll bring people out like, oh, I can do this. This is not as hard because, of course, whenever you go and you have to talk before, anybody, you're like, oh my gosh, I don't know anything, but, I can tell my truth. I can tell my story. And then if I need to back that with some stats, I can get you on that end too. But, so having that weight and balancing it out. Mhm. That's it. That's awesome. See Molly. Hey, Molly.
Hi, sorry I couldn't find my button.
Okay.
Hi, sorry I joined a little bit late and I missed part of your presentation, but I'm Molly Parker. I'm in Spokane, Washington at Gonzaga University. Um, and yeah, I was just thinking about ideas and like ways to frame it. I think I'm struggling in my nursing department. We have a Center for Climate Health and the Environment, or Center for Climate, Water, and the Environment.
Hmm.
Campus that does a lot of great environmental health work and is building Spokane as like a resilient, climate resilient town with smoke and heat,
Yeah.
partnering with the Department of Health and community organizations and doing really great work. But within the nursing department here on campus, there's not as much buy-in on climate being an issue. And we're like, I felt like everyone was going to be interested in this. I'm new here. I just joined last year, but I thought everyone would be interested in this topic, but I realized they're not. And but
Right.
we're revising our curriculum based on the 2021 Nursing Essentials. And
Hmm.
so my like little avenue is bringing up that population health domain and the that we have, like, this is not just my like soapbox. This is like what nurses are agreeing should be included in a nursing education um now, and just kind of leaning on that and saying like this is an essential part of nursing education as we move into the future. And um, we have to do this, you know. And then introducing like the Annie and the planetary health
Mhm.
resources for curriculum stuff and just being like, yay, here's our, yeah, the competencies. Thank you.
Yeah.
Uh, I think that's just kind of like my intro. Even when I introduce it to students that may not want to hear it, I'm just saying like, hey, this is now a required part of your education. We agree this is
I
important
agree.
looking at human health.
Mhm.
And then I think I get a little calmer reaction. But yeah, it's still just interesting in this region. We've got so much smoke and heat
Yeah.
increasing, and it's still just no, sometimes the dots aren't connected. But that, and then I really appreciated the Planetary Health website has a One Health video out of a hospital in Colombia,
Okay.
and it just shows this like indoor outdoor hospital that's you know, really doing a lot of work to reduce waste and have this, it's got lots of footprint. So I'm like, here's an example of how we could make this work, or the Boston rooftop gardens, and giving them like samples of what could be has been a little more hopeful, and instead of just barking at the problem.
Right, exactly. Go with those being solution focused. I see Ebony about Texas. I lived in Texas too, so I know about Texas as well. But that's, like you say, starting early in the curriculum, like you say, building that into like somehow building that into like the nursing curriculum. Like you got to have a planetary health course. How we have the community, community health, mental health, then all the different type of rotations, building that in there. So that's kind of, I think, I don't know. Dr. Kent, can he talk more? Because I think he has classes on that. So, but other schools, like even at the local colleges, starting like the, elementary and high school, because I remember when I went to elementary, we would do like things about climate, learn about the sun. We used to make our little, solar eclipse, aluminum, I'm aging myself, aluminum foil glasses to look in there and learn different type of plants and all that kind of different things. So kind of incorporating that, if we can start putting a push for that, incorporating that into the program, like you said, how you're giving them bite-sized pieces and getting them, putting a little bit on the hook, and then somebody will bite and, be, like it'll be second nature. Like, hey, when this patient's here, if they're home and, their environment, they have asthma or their water, and then tying that into nurse and also kind of taking that focus, because we're task focused at nurse. When I got to give this medication at this time, I got to do this care plan. So just kind of reframing it. And I see Ebony would like to say something.
Think.
Yeah, right now, and I don't know, each state's kind of different about its nurse residency. And so one of the things that we were called on to do in Texas is try to standardize nurse residency programs. And so in my policy council committee, I brought up the disaster preparedness and environmental piece as being like, as we work to kind of formulate some type of guidelines, as it being a key component of nurse residency, that
Yes.
we're training nurses for disaster preparedness, either volunteer or some components where it's like mandatory, but then some that are volunteer, but then also, looking at care through the environmental lens, and that being a key component to nurse residency.
Mhm.
I pray that there's a lot of support for it at this junction, but as we move forward, that is pretty much key to the work that we're doing in standardizing the nurse residency. And so that's been a really interesting avenue as well, for nursing, I should say.
Mhm. That's awesome. I think Dr. Kent, Dr. Boyd.
Yeah, I didn't want to interrupt the discussion because there's so much good going on right now. But a lot has been I've been reflecting on a lot, and I have some commonalities with these and some connections. So uh first, to the education and linking with the essentials. Yeah, absolutely. So it is mentioned in there. Climate change is mentioned, I think, twice. Planetary health is mentioned once. And also at the University of Minnesota School of Nursing, I was part of a team of four to crosswalk the planetary health education framework with the AACN essentials,
Oh,
which
nice.
really helped to show how we can integrate planetary health into not just the population and climate change competency, but all competencies at varying levels. And we were able to present that to the faculty, and it led to the adoption of planetary health embedded into all levels of nursing education at the school, University of Minnesota. So from BSN all the way through DNP and PhD. And the reason I say that is not to brag or say like, hey, we've done this, but Dr. Teddy Potter offers that crosswalk tool with a simple email to her. So if there are folks that are interested in that, certainly reach out to Dr. Potter. And I was going to send that link, but navigating that and Zoom is difficult for me.
Right.
Multitasking is hard. Um,
Yes.
but but just wanted to share that. Um, I absolutely understand and share the sentiments of it's difficult to get practicing nurses, whether it's schedule and workload, or interest involved or understanding of the intersection of climate and health, sometimes, unfortunately, well, definitely unfortunately so, and bafflingly so. As Ebony mentioned, we can frame it in multiple different ways, whether it's disaster preparedness, we can call it weather. Climate is just long-term averaged weather, if we're being pedantic about it. And so, I think there are ways to do that, and I wonder if that may be something this group can do in between the moments of gathering and having presenters, share with us their work, but share out and call out some of the work that we're doing as members in between those settings, and we can talk about some of the work with like the Global Consortium on Climate and Health Education and the resources that they're creating for students, faculty, and practicing nurses. Um, Other work, and then lastly, Christina, I wanted to acknowledge what you were saying about extension and master gardener, because
Yeah.
I, in my current role, work for the University of Minnesota Extension as a
Mhm.
nurse. And so I think there's a lot of possibility there, and I was excited to hear that other people were thinking about that in the lens of extension in other states. Um, and so that could be I don't know if it turns into a pilot. I don't know if it's outside of this work or in partnership with this work. Um, but definitely there are models there, and Extension is another trusted messenger within the communities that they serve. Um, and so there are a lot of opportunities there. And so I'd be interested to explore that further. Um, that was kind of, I wanted to touch on all of those. And then I do have a question for you, Dr. Gordon, but I'll let Tom go first, and because I can always ask you off air too. But I've spoken enough for right now, so I will pass it over to Tom.
No, that's excellent, that information. Hey, Tom.
I have a vague memory that from years ago that in my family planning program or whatever we called it then, there was a concept of the one key question, which I think was, are you planning to get pregnant this next year? So I think one of the things that this group could do for all of us is recognize that I think we have about 500,000 people who are elected in the United States, and at least 400,000 of them will be on a ballot of some kind or other this coming spring, either a primary or a school board or whatever. And if we all knew what the one key question we should ask every candidate at every level about climate, I think that would be a fun thing to get out there to all of us and to students and ask, the person running for school board, the person running for the local library council, the road district, the city commissioners, state legislators, or whatever. What's the one question we should ask them all about climate with about what they plan to do after they're elected?
That's good.
I don't know what the question is, but I would like it if somebody would tell me what I should ask.
Well, I guess, yeah, whatever pressing issues, I mean, that, that in the climate, or like, what are your viewpoints, or, on climate or planetary health, or like I said, what are you planning on to do? Like, what issue do you want to pinpoint out? What are you planning on doing against the air quality? Or if this, for me, it'll be like the factory or replacing lead pipes, locally. But then, so just kind of find out the niche, whatever your passion or need is in your area. That's great.
I think it's kind of like the question I like to ask like executives when I get a chance to, or like CEOs, and I always ask them what keeps you up at night.
Oh yeah.
And and typically later on they're probably like, maybe think about that. I hope to think that they think about that, but you
Hmm.
I get what you're saying. That one question that we should ask all, you know,
Hmm.
persons that are in a position of, decision making as it pertains to climate, like what is that question? And I would like to know it as well.
Exactly.
Thank you, Kent, for putting that link in the chat. I appreciate that. And also, Anupam put in the course that's currently being run. I know Annie's a partner on promoting that course and the partnership with that. So thank you for sharing that. Kent, did you want to ask your question?
Yeah, sorry, I got caught multitasking again.
Uh-uh. I'm trying to find the chat.
uh, yeah, so Dr. Gordon, you spoke to this a few times, so you may not have a ton more to add, but I was curious about the Michigan navigators, and then later understanding that they're nurse navigators. But I'm curious. Um, I guess what I'm most fascinated about is that they go into the settings and really learn about, we can talk about air pollution or we can talk about heat, but if you're worried about your filters, like we need
Hmm.
to address that first. And I think that that's such a strong message, something that nurses can do so well.
Hmm.
Um, so I guess I'm trying to find out where the question is in this, again, because you have touched on it so much. The reason that I'm interested in it is one of the programs that we have educates community members to take climate action.
Yes.
And an advanced training of that, something that I've heard from public health departments that maybe don't have as many resources or capacities, is that they don't have those navigators within the community that can, beyond the nurse doing the home visit,
Right.
um, they don't have those connections. And so, is there a way to educate community members to be those navigators, whether it's in our perspective, we're thinking of climate and health navigators that can be that source of information. And so I guess have there been any thought, maybe you're not in a position because you have 14 navigators, but have there been any thoughts of expanding that work, or maybe that already exists in Michigan? And then if you can speak to it anymore.
Yeah, so we do ambassadors. So when we go
Okay.
out into the like into the community, so like my partner also used to work for the health department. So that's actually kind of I became an extension, like a mobile dispatch, like of the health department, CDC with that. So what we do in the community, like even if it's blood pressure or whatnot, we go like even to a lot of the local churches, faith-based organization, doesn't matter which faith it is. We go to there, we go, it's all over. And so we'll have people, do you want to be a champion or do you want to be an ambassador in your local congregation? Like, do you want to be an ambassador of taking blood pressure? So we create a program where they're, go through a training and now they're ambassador to teach others or to recognize signs. Also, we do that with CPR. We do it with the it's like the filters. Okay, here are the masks or the filters. We'll bring these to this local church or to the senior center, and they'll have their ambassadors there. We got these filters that you can pass out if people need filters for their water or other things like that. So we do incorporate, like I say, making the community and the people that we are, not helping them, as my one partner say, activate their healthcare power, and activating their healthcare power starts with them. And so that we're big on that health literacy piece. So we're, not so, if they go to the physician or, they can actually speak to what's going on and have that dialogue, that two-way conversation. that teach back and all that with their physicians. So we're big on educating the community to be an advocate for themselves, especially like during this time. We have they have limited resources to access to healthcare, access to other things, food or water, and so it's just not just the health stuff. All those social drivers, social determinants, we have the resources and connect them, and then we take the person that the champions or they love have these classes on the different disparities or different topics, and then they have we do this by Zoom, we do it by in person. So in court, keeping that community engaged, that's a big thing, as you say, and making them their own champion. So like no one's coming in here to like you're not going to get me all the time. I'm not going to be able to, even though they call me all the time, but I'm not going to have that. But like you speak to having those programs or those ambassador programs, like I think I did a climate ambassador training online. And so we even provide that to the community. Hey, you want to be a climate ambassador? Take this training, and you also can use these tools to, your reach will be further. You teach one person to fish, is that one person, but you give them a fish, as you say, but you teach about a fish, they can throw it out and bring it in all day. So that's an excellent thing. Collaborate using the community, or not using the community, incorporating the community, and letting them have the voice at the seat at the table. I don't know if that answered or that answer.
That did. No, and that's
Yeah.
wonderful. Yeah. And I was going to say, Christina, I don't know about you, but I hear an extension program. So,
Yeah. Yes. So that, and the thing about it is the sustainable piece is like, getting, a lot of times, like say the funding for these programs, but you also can do stipends to bring people in, like, over 3 months by if you get money for it. But if not, volunteer, wise or whatever, like, hey, you want to be, they love to volunteer, be responsible at their church or their, their, even we go to like housing departments, we go all over. So, there's no place that we don't go in our community and teach. And so that they really are responsive to like, hey, I don't need you coming here telling me like, we had one drive where we brought like, the people came with us and they brought like food boxes. They're like, well, I don't need that. I don't need that. I need meat. I don't need vegetables, so just find out, having those conversations like, hey, we're coming in here to meet, meet, what do you need today? What's the topic of, more support? What's important? Like that question, what's important to you? What do you want to see resolved? And then give them their voice and like having them like, okay, not someone speaking for them, but also give them that health literacy, teaching them how to advocate for themselves. That's the biggest thing. Yeah.
This has been such a great discussion. Does anyone else have any questions or comments or?
And this like kind of uses model too, like also now like and I do it with gun violence. So I have the nurses and I have gun violence or violence interrupter navigators in Detroit. So they go out in the community and we do a presentation. We have passed like the Safe Storage Act. So that's basically like with the firearms, they have to make sure all firearms are locked up. So this model has gone out and we've reached about probably like over 30,000. I do the TikToks and then they go like that canvas. It's kind of like, organizing model, the canvassing, but these people are from their communities. So they're trusted in their communities and they feel comfortable going door to door, knocking on people's doors and ask them, do you know about this Safe Storage Act? Or same thing, do you have, like say again with the water filters, or do you, do you need, what's going on? And you get so many interesting conversations, personal conversations at that door to door, interactions. So. Anyone else has anything interesting to ask? I think Ebony and Dr. King, Tom. So what is everybody else doing out in their community or of interest? So everyone has my email. So Christina, we can definitely get together because we're like neighbors, like I think 40 minutes away from each other. Yes. Do you know Dr. Heatherland at all? Heatherland? No. Okay.
No, I'm newer to Michigan here.
Okay.
So,
Okay. She's in the Flint MSU and Dr. Edwards, I love to have you coming on some of those meetings and stuff like that. Yeah, kudos team is a great discussion, great ideas I'm taking down, and I'm looking for that toolkit. Kudos to Dr. Boyd for that, developing that nursing program. That's the big thing. So I think it's like the unknown, even with medical providers, like, I don't have time. The same conversation came up in with cancer care. Like, how can we get people, to come out and advocate, like, instead of looking at this another thing on my plate, developing a different passion for it, and using your expertise, your other skill sets. So it might not be just you're coming as a physician or a nurse, a master gardener, or a plumber or whatever, that other skill sets that we all possess, bringing that into the conversation in the community. That's excellent. And that's all I have.
I was just going to share out. Sorry, I can't find my raise my hand button.
No, that's fine.
Just interrupting me. Sorry. I was going to share the Climate Center here at Gonzaga had a very large EPA grant that
Yeah.
got taken, but they did really good work on the smoke resilient Spokane. So one of the projects that I'm involved in that's kind of still able to hang in there is they have these air quality dashboards, and it's local monitors, and they have it indoor and outdoor at a lot of our community centers and libraries that are like resilience hubs. So we're one of the things I'm working on is just trying to understand how community members are interacting with these dashboards. Do they understand what the AQIs mean? Do they understand when to take precautions? We've got guidelines, but a lot of people just don't know how to put that into action with like youth sports and summer camps and all these outdoor programs, recess, and all these things, and like how do parents and how do community members and community leaders like really advise people on when to take precautions in smoke, when do coaches cancel practice, when do we bring camp inside. And the local air monitors really are helpful because sometimes the EPA ones aren't accurate for local specific areas if they're out in rural areas away from the sensors. So it's just been like an education piece that we're trying to get out into the community more on how to interpret and provide guidelines on AQI, like in a citizen science kind of way.
Right. That's awesome.
But we have lots of wildfire smoke here, if wildfire smoke is starting to hit your region, like I think the West Coast is getting lots of good ideas on how to deal with it.
So yeah, that Canada, like, yeah, because that was like, I think it's kind of my daughter. She's in Los Angeles, so they had the, you know, there, and we get, like I said, Canada kind of, that was rough for us and whatever. So those air quality monitors, I think, like, so we only had that one here in Flint, and someone destroyed it, so they got it back. But teaching people how, I usually show them like the dashboard, because we have, like, our health department will have the air monitor or whatever you could go to, especially like if you have allergies, he'll tell you like if the mold is up today, or teaching people actually how to read that. So that will, disseminate that information and that health literacy piece, going to those different spots that you probably already do, the schools, and having education on that. It's awesome. Great. Yeah, everybody's doing wonderful work. Yes. Awesome.
Thank you, everyone, for joining. I believe that we are taking off December. We meet the third week of every month. So I know December's pretty busy for folks. So we are going to reconvene this committee in January of 2026. So we had a lot of great ideas today for the JEDI goals, and hopefully we'll have some great ideas for the next year.
Yes, awesome.
Yeah.
Well, thank you for this great honor and privilege to present and have this great dialogue and discussion, and these brilliant minds and ideas. I'm excited about next year and what we're going to do together.
Yeah, thank you all. Thank you, Dr. Gordon. Thank you, Sarah. And
Yeah.
happy holidays, everyone. And we'll see you in the new year.
Thanks, everyone.